Hey everyone, welcome back to the channel. Today, we are diving into a story that's both inspiring and heartbreaking, California's rollercoaster journey with healthcare. Just a few years ago, the state was on the brink of achieving something extraordinary, nearly universal healthcare coverage. But now, millions are losing their insurance. What happened? And what does this mean for the future of healthcare in America? Let's break it down. First, let's set the stage. California, a state known for its progressive policies, managed to push its insured rate to a staggering 95%. That's huge. Personally, I think this was a moment of real hope, a glimpse of what's possible when a state commits to its people. But here's the kicker, that progress is unraveling. By 2030, the uninsured rate could nearly double to 15%. What makes this really interesting is that it's not just about numbers, it's about people's lives. We are talking about 2.2 million Californians potentially losing coverage, with undocumented immigrants and low-income families bearing the brunt. From my perspective, this isn't just a policy failure, it's a moral one. One thing that immediately stands out is the human cost of these cuts. Take Ramonte Means, for example. His wife, Candy, died from cervical cancer in 2008 because she couldn't get proper care. Back then, the system was broken, and poor black patients like her were often ignored. Today, Means works multiple part-time jobs just to keep his kids insured. He's not asking for a handout, he's asking for dignity. What many people don't realize is that stories like his aren't relics of the past, they're warnings for the future. If we don't fix this, we are going backward. Now, let's talk about the why. California's healthcare expansion was ambitious, but it was expensive. The state spent over $10 billion a year to cover undocumented adults and children. Republican lawmakers and even some moderate Democrats have criticized the cost. But here's where it gets complicated. The cuts aren't just about saving money. They're about priorities. In my opinion, when you cut healthcare for the most vulnerable, you're not just balancing a budget, you're making a statement about who matters in your society. What this really suggests is that universal healthcare isn't just a financial challenge, it's a political one. Governor Gavin Newsom campaigned on a promise of single-payer healthcare, but he pivoted to expanding Medi-Cal instead. That was a huge step forward, but it wasn't enough. Now, with budget shortfalls and federal restrictions, the state is backpedaling. This raises a deeper question. Can we ever achieve universal healthcare if it's always the first thing on the chopping block when money gets tight? A detail I find fascinating is the role of federal policy in all this. President Trump's tax reform law cut billions in funding for California's healthcare programs. But here's the twist. California's budget deficit started before those federal cuts took effect. So, is Washington really to blame, or is this a homegrown problem? Personally, I think it's both. Federal policy matters, but so does state leadership. If California wants to be a model for the nation, it needs to find a way to sustain its commitments, even when times get tough. If you take a step back and think about it, this isn't just California's story, it's America's. Healthcare is still a privilege in this country, not a right. And until we change that, we'll keep seeing these cycles of progress and regression. What's happening in California is a wake-up call. It's a reminder that achieving universal healthcare isn't just about passing laws, it's about building systems that can withstand political and economic storms. So, where do we go from here? I don't have all the answers, but I do know this. We need to stop treating healthcare as a political football. It's not about left versus right, it's about right versus wrong. Millions of lives are at stake, and we can't afford to get this wrong. Let's keep the conversation going. What do you think? Is universal healthcare possible in America? Or is it just a dream we'll never reach? Let me know in the comments below. Thanks for watching, and I'll see you in the next one.